New research from the University of Copenhagen and Copenhagen University Hospital shows that low blood vitamin D levels increase mortality.
We have shown something completely new for the first time, that people who through their genes have low vitamin D levels have increased risk of dying early on, particularly of cancer and other diseases, but not of cardiovascular disease. Why is this important? Well, we have known observationally that people with low vitamin D live shorter than the ones with high vitamin D, but we have never known whether it's a causal effect, and that's what we know now. Low vitamin D leads to early death.
To carry out our study, we used 96,000 participants from a general population study in Denmark of white Danes. We carried out 30,000 measurements of vitamin D and 96,000 genotypes.
By examining the role of genes, the research goes beyond earlier studies that has shown a statistical connection between vitamin D levels and mortality.
The problem with previous research is that we don't know what's the chicken and what's the egg. So is it low vitamin D that causes early death, or early death is caused by some diseases that lead to low vitamin D? It could also be due to what's called confounding, that some lifestyle factors both lead to low vitamin D and to early death. We solve this problem by using genetics. So we look at people's genes that lead to lifelong low vitamin D and early death, and by this way we circumvent confounding, and there's no way death can change your genes.
Our results, they show that low vitamin D is associated with increased all-cause mortality and increased cancer mortality and increased other mortality, but not cardiovascular mortality as suggested by observational studies.
The best way of increasing vitamin D levels in the population remains unclear, but there are different possibilities for preventive actions.
There's 3 ways of getting vitamin D. You can expose your skin to sunshine. 5 minutes to 30 minutes twice a week is actually enough. It explains 80% of plasma vitamin D. Then you can eat vitamin D either as fatty fish or dairy products, or you can take supplements. In some countries, like in Denmark, in the winter time, the sun doesn't shine very much, and therefore you don't have the option. So you might think of the 2 other options to do so. But generally, it's most advised to use sunshine as long as you don't get enough so you get skin cancer, and then to eat vitamin D, fish or dairy products. Whereas it's a bit more debatable about supplements, because we don't really know whether supplements are beneficial enough. There will be a big study published in 2017 that will give us the answer.